Good afternoon. I'm here to present a strategic plan on the Princess Margaret Hospital by Jennifer Stubbs. The Princess Margaret Hospital was established in 1952 in New Providence, Nassau, Bahamas. It has a bed space of 402 beds to facilitate the need of all ill patients. Our hospital is guided by a vision and mission statement whose essence of the institution is to provide quality health care to all Bahamians and visitors to our shores. To provide better care to all patients, a new critical care suite was constructed which occupies six new theaters, a neonatal intensive care unit, an intensive care unit which has a total of 70 bed spaces each. We provide ambulatory services, primary and tertiary care, which cater to the needs of all patients. In order to better accommodate the need for healthcare in the Bahamas, PMH has developed a 3-year strategic plan that will help to achieve and accomplish goals that are relevant in assisting employees to deliver proficient service to their patients. To allow proactive and improved services to be maintained, the executive team strategically designed an approach plan to help maintain growth within the institution. Areas that became concerned are improvement of clinical outcomes, service improvement programs, infrastructure development and training, and staff development. To better help improve services, a SWOT analysis was done, which gained access to the strengths, weaknesses, opportunities, and threats of the institution that will help to improve services and healthcare to all patients. Let's look at some of the strengths in the SWOT analysis. New and innovative services, where you have the implementation of the new critical care block, providing the hospital with, like mentioned before, 7 new theaters, improved technology within the critical care block. It is superior located, centralized, where both residents and non-residents have access to the hospital. Cost advantages. It's cheaper. Maybe you even are able to get free services. Some of the opportunities that we could use are social media advertisement, where we can introduce the use of social media so that patient and staff relation is continued even after discharge, and also to promote and advertise the service provided by the hospital. The availability of new technology, the implementation of new technological services throughout the entire hospital so that all staff will become technology advanced and prepared for the culture of technology. Then we have some of the weaknesses where we have no technology use in the hospital, where no computer systems are available within the units or the ward for patient demographic and staff lack of computer savvy techniques. Provision of patient care, where you have a shortage of bed space available for sick persons. Then you have the management and staff shortages, where you have a shortage of nurse, physiotherapists, and general surgeon. And then you have the threats, where you have loss of key staff, where you have nurses just leaving because they're being underpaid. Then you have new competition, where you have the introduction of the new state-of-the-art hospital, which is located 5 blocks on the same street, which offer cheap and affordable care to patients. And then you have change of the insurance plan, where the introduction of the national health insurance, which will put all Bahamians at the advantages of choosing a primary physician at a cheaper cost at a different institution. The plan outlined will help to improve performances and oversee the internal and external operation of the institution. Growth will be sustained in education and technology to improve, which will allow them to render high quality service to all patients. Better use of proper equipment and infrastructure, like development of the new critical care block, which allow patients to experience better and affordable health care. Like mentioned before, once staff has more knowledge and training related to technology, it will also promote better healthcare service and provision. As stated before, the time frame implemented for better outcome of the strategic plan is 3 to 5 years, which will allow better performance and services of health care, educate employees to perform their tasks well, allow growth in staff, which will allow employees to become more conducive to working in their environment. By implementing these new strategies, it will allow patients to become more adjustable to paying less for care as the National Health Plan is being introduced and which will provide affordable health care to all. To achieve these objectives, some finances will be needed. As allocated by the government budget of $250 million a year, this money will assist with the upgrading and development of institutions to help improve healthcare, development, and education. Some $75,000 will assist with purchasing new equipment. For example, the new CT scan machine that was purchased 6 months ago, new laboratory care services to allow bloods and other samples to be done within a time frame of about 2 hours, $250,000 to help in training staff and providing technology equipment, $2 million to assist with infrastructure like the renovation of the accident emergency, which can now accommodate up to 50 patients being served at one time. Then you have the renovation of the children's ward, which will now be able to accommodate 100 patients per shift, and a new surgical suite, which will now accommodate 50 ill surgical patients. Then again, you have some $1 million, which will assist with providing care to patients, to assist with medication, diagnostic testings, and laboratory testing. To help improve all of the healthcare needs at the Princess Margaret Hospital, to help in delivering better services to the customers, there are some resources which will need to be provided, maintained, or upgraded. Some of these are a new research lab, which will be relevant, and this will aid in technology support of care with updated service provided to patient, education, development, and training seminars that will aid in the use of new performance tools, a campus research lab, and education provided weekly for staff to upgrade in healthcare services, then the use of better technology equipments to better validate or provide information related to patient care. Then you will have the need for more surgical, diagnostic, and radiology equipment to provide and offer faster services to clients. And then you will have more bed space to accommodate an increasing demand of patients who need care. Let's look at who will benefit from this plan. Employees, most of all, who will be allowed some upgrading, better education, more access to research, where they will be able to provide patients with better care and services and be more knowledgeable about what is taking place in the healthcare environment. Then you have the patients, yes, the patients, who is the primary care or the primary provider within the hospital or the healthcare environment. Patients will have access to more services, better health care will be provided to them, and then patients will be able to get more assistance in need and care so that they could go home to their loved ones much quicker. What are some of the limitations we will experience? You'll have an increase in healthcare equipment, which you may have the cost of healthcare equipment may go up, which may cause the hospital to suffer a little because the money may not be provided for all of this. It will be hard to purchase. We'll have great expectation from the community. Here it is, when patients come to the hospital, they're expecting more service, better services. So therefore they'll start complaining, and then it'll cause frustration, it'll cause patients to become upset. And then you have an increase in demand where you have more of the population are becoming more iller. Then because of the population becoming more iller, it will cause for bed space, more provision of bed space. And then it'll have an effect on the medication that is available for the need of patients. So here at PMH, our commitment is to increase and invest in patient care, improve productivity, and implementation of new technology to assist the need of all at our institution. It is our best interest with the implementation of this strategic plan to deliver sustainable health care to all and ensure we provide great care now and in the future. Thank you.